According to the World Health Organization, 1.7 billion cases of diarrhea occur among children under the age of 5 annually. Acute cases can lead to significant fluid loss and dehydration, which may result in death or other severe consequences.
In the worldwide kind of perspective, a global perspective, there's 1.7 billion people who come down with diarrhea every year. And in our local context, admission rate for gastroenteritis is up to 40% in a public hospital. So in my own practice, I see about 1/3 of the patients who come in for medical problems with diarrhea and vomiting.
Children come in with abdominal pain, diarrhea, watery stools, and sometimes even vomiting. It is probably, I would say, 10 to 20% of the cases that we see, especially when they get admitted to the hospital.
So diarrhea illnesses usually presents with more frequent and loose stools. Naturally, the frequency of which is highly dependent on the age of the child. A good guideline would be when they're more frequent than usual and more loose than usual. It can be up to 3 times a day for the older ones, or sometimes up to about 8 to 10 times a day for the younger ones as well.
My main concern about treating diarrhea is that of fluid loss in the baby. And when the child loses a lot of fluids, they get this condition called dehydration, and it can lead to long-term morbidity and mortality.
Because it can affect the kidney, they can cause kidney disease.
Morbidity can be a form of seizures, fits.
In more severe cases, they can even cause stroke.
Brain damage if the condition is quite bad.
In children especially, diarrhea diseases, when they become dehydrated, is something that we need to act quickly. Children, compared to adults, they are much smaller in size. So once they start losing fluid, be it from diarrhea or from vomiting, they become dehydrated much faster. And also they become more severe faster.
Treatment for diarrhea's mainstay is that of rehydration.
So generally, we want to give them what we call oral rehydration salt, which usually contains different types of electrolytes to replace whatever they may have lost from the diarrhea from the vomiting. If they cannot do it orally because of, for example, they are vomiting, then we may need to admit them to the hospital and give them what we call intravenous hydration. There are other treatment options that we do use.
There are things like smectite, which is a powder that lines the intestinal wall to prevent the infection in getting to the body. They may help.
Anti-diarrhea medications suitable for adults are not allowed to be used in children under 2 years of age because of safety profile. Now, the most common choice that is available for adults creates rather undesirable side effects in children. In the mild cases, it worsens or prolongs that of diarrhea illnesses. In worst of cases, actually creates a medical ileus and sometimes increase the chance of invasive gastroenteritis. The younger you are, the more vulnerable you are. And that also has an impact upon how you treat the child and your choice of medication as well. For the younger ones and the more severe ones, I might consider adding in other agents such as antisecretives.
There's a new drug called Rasicadotril that has come into the market, and this is a very interesting novel drug in which it is supposed to reduce the secretion of diarrhea when there's a viral or bacterial attack. The Rasicadotril is a novel new drug that is on the market which shows a big promise in helping children with diarrhea. The main function is that it reduces the secretions of diarrhea and therefore help the child recover a bit faster. And it reduces the duration of diarrhea from 36 hours to 6.9 hours. Because of the frequency of the stools, a lot of children get loose stools and they have abrasions around the anal region. But with this Rasicadotril, you find that the stool output is lessened and the stool doesn't get as liquid as before, it gets more bulky, and that reduces the soreness of and irritation of the perianal region. Many patients come back to me to tell me that it is a very useful drug in the sense that in the stools it's less liquid compared to before, and the stool tends to be more bulky even after a day or so. Most parents who used it have come back with good reports that this drug is useful in helping reduce the diarrhea in these children. They also find that the child do not reject the medicine because it's in apricot flavour compared to the other drugs.